in the Zero draft was considered to be a major gap. Subsequently, NGOs internally lobbied their governments to embrace health in the Rio+20 process. The WHO has displayed leadership in this area. In providing feedback to the Zero draft, many stakeholders emphasized the core relevance of health to sustainable development. Previously agreed language in regards to our commitments to health from prior resolutions was emphasized in these submissions. The leadership of international NGOs in providing feedback and lobbying, such as the International Federation of Medical Student Associations and the NCD Alliance, must also be acknowledged. In the next iteration of the Rio+20 text, health had a dedicated section, and there were several references to health scattered throughout the text. During the subsequent preparatory committee sessions where the text was negotiated, health was one of the less controversial aspects of the text, especially compared to the contentious issues discussed elsewhere, such as gender rights, means of implementation, and technology transfer. However, the paragraph on reproductive health was an exception, with one particular state consistent with their disagreement with any commitment to reproductive and sexual health in relation to sustainable development. The first text produced under Brazilian chairmanship maintained the reference to reproductive rights. However, after subsequent consultations, unfortunately the reference to reproductive rights was removed, to broad condemnation from many member states and civil society. The final health chapter has several paragraphs covering key thematic health issues laid out as follows. An acknowledgement of the core relationship between health and all three pillars of sustainable development. Recognition of the importance of universal health coverage. Strengthening the fight against communicable diseases. Acknowledging the global burden and threat of NCDs and how NCDs constitute one of the major challenges for sustainable development in the 21st century, in line with the General Assembly resolution from last year. Recognition that reducing pollution has positive effects on health. Reaffirming previous trade commitments, including TRIPS, the Doha Declaration, and the WTO General Council decision from 2004. A call to strengthen health systems, acknowledging the leadership role of the WHO. A call for the full and effective implementation of the Beijing Platform for Action and the ICPD Program of Action, emphasizing the need for universal access to reproductive health and the integration of reproductive health in national strategies and programs. Finally, there is a commitment to reduce maternal and child mortality and an acknowledgement of the importance of comprehensive access to modern methods of family planning. In summary, this text represents a real integration of the pillars of sustainable development, and health has been portrayed as an essential precondition and indicator of sustainable development. From having no real emphasis on health in the Zero draft, thanks to the commitment of member states, non-governmental organizations, and the leadership of the WHO, we now have a dedicated health chapter, and health has been referred to in several paragraphs pertaining to sustainable development. At a different level, it would have been ideal to have health truly integrated as a cross-cutting issue throughout the text, with a dedicated commitment to using health indicators as a core measurement of sustainable development. Although there is broad mention of the key health themes in the text, there is a lack of specific targets and timeframes. The process for determining the sustainability development goals has been referred to a working group. Therefore, as a health community, we need to come together and draw on our collective expertise to clearly identify quantitative health indicators and lobby for their inclusion in the SDG process. Thank you.